Anna Maria Young. I am board certified in oncology, lifestyle medicine, and obesity medicine. And I'll be going through some of the basics about some background information on perimenopause and menopause. Okay, so I wanted to start with talking about the timing of perimenopause and menopause. Menopause usually happens between 45 to 55 years. So that means that perimenopause can start in the late 30s and into the late 40s. The first phase is the late reproductive phase, and that happens usually in late 30s and early 40s. And as you can see here, the estrogen levels rise and fall cyclically during that time. Periods may be regular, but subtle changes start to appear, such as your cycles might be shorter, you might have changes in flow or duration, or worsening PMS symptoms. Then women go into the early perimenopause phase, which usually happens in the mid 40s, and this varies in length significantly. So for some women, it is only just a few years. For some women, it's many years. And during this time, women have significant changes, fluctuations in their estrogen levels. And it's specifically defined by cycle length varying by 7 or more days. So one cycle will be 28 days, and then this can be followed by a cycle that's like 35 days. And that's how you know you're in the early perimenopause phase. This is a time when women will start having some symptoms, some of the more usual perimenopause symptoms that we'll talk about in the next slide. Then we have the late perimenopause phase. This is usually in the late 40s. It is only 1 to 3 years in length. And this is when estrogen levels really start to significantly decline. And it's defined specifically by going 2 or more months between periods. So when you start having episodes of 60 or more days between periods, that's when you know you're in the late perimenopause phase. And that also indicates that you are close within 1 to 3 years of your final menstrual period. So your final menstrual period is what defines menopause. Once that happens, then you're in menopause, and then you enter the early menopause phase. Menopause, the average age of the final menstrual period is age 51, so it ranges from 45 to 54. And once women are in the early menopause phase, that lasts 5 to 8 years. And during that time and in the late perimenopause phase, women tend to have a lot of hot flashes and night sweats if that's what they're going to have. So the hot flashes, which are very common, usually happen in this late perimenopause and early menopause timeframe. But those two timeframes together last on average about 10 years. So that's 10 years of having very significant perimenopause and menopause symptoms. Once women are in early menopause, that's when estrogen levels have declined and are consistently low. And then after the first 5 to 8 years in menopause, women go into late menopause, which is the phase that lasts the rest of their lives. Estrogen levels drop and stay low. The symptoms that were related to fluctuation of hormones stabilize and usually go away. And then symptoms that are related to low estrogen, such as vaginal dryness, genital urinary syndrome of menopause, those actually increase in late menopause. This slide I like because it shows you estrogen levels over a woman's life. And so you can see that as girls go into puberty, their estrogen levels rise. And then once they're in the reproductive years, estrogen levels are pretty constant. So they can go up, they're going to go really high during a pregnancy. Otherwise, they're fairly constant throughout the entirety of the reproductive years. And then in the early perimenopause and late perimenopause phase, estrogen levels really are all over the place. They have huge peaks, very low troughs. The estrogen levels are very chaotic. There's a lot of change. And it's really this fluctuation in estrogen levels that is causing a lot of the perimenopause symptoms. So it's not necessarily that the estrogen levels are dropping all of a sudden, it's the fluctuation in the estrogen levels that cause the symptoms. Eventually, then the estrogen levels drop and are stay consistently low, and that's the postmenopause phase. So the symptoms of perimenopause and menopause are innumerable. This picture really does a nice job of showing you how many symptoms can be attributed to the perimenopause phase. It's crazy things that you've never thought of before, like gum problems or burning mouth or itchy ears. And then things like hot flashes that you've heard about multiple times, that are really common. So the most common symptoms are hot flashes and night sweats. Women have a lot of mood swings, irritability, anxiety, depression. There's sleep disturbances, usually insomnia. Fatigue is a very common symptom. Sexual dysfunction from vaginal issues, vaginal dryness, and genitourinary syndrome of menopause. And then joint pain is actually quite common. So the musculoskeletal syndrome of menopause is something that has actually recently been defined and explained. It is very common. 71% of perimenopausal women have musculoskeletal pain, and it is due to lowering levels of estrogen, which then causes an increase in inflammation. Women get arthritis, joint pain, and then frozen shoulder is actually quite common. The decreasing levels of estrogen cause decreasing bone mineral density, which then leads to osteoporosis eventually, and then decreased muscle mass, which over time leads to frailty, weakness, poor balance, and poor recovery after injury. There is also the genitourinary syndrome of menopause, which we've known about for quite some time. It's been around. It used to be called just simply vulvovaginal atrophy, which is actually a part of the genitourinary syndrome of menopause, but not the entire syndrome. And then prior, years ago, it used to be called senile vaginitis, which doesn't describe anything that's happening in this syndrome. So decreased levels of estrogen lead to vaginal symptoms, urinary symptoms, and sexual symptoms. And it has to do with the fact that the vagina, the vulva, the base of the bladder, and the urethra all have tons of estrogen receptors. And so as estrogen levels fall, then those tissues start suffering and having problems. So women will have vaginal dryness, burning and irritation, urinary burning, urgency, and recurrent UTIs. Um, because of the vaginal dryness, they can have painful sex. And then on exam, on looking at a woman's vulva and vagina, you can see atrophy of the labia minora. So the labia minora actually gets smaller and sort of goes away over time. You get atrophy of the clitoris, so again, it goes away over time. And then the vaginal tissues become dry, they become pale. The vaginal mucosa bleeds easily on contact, which can be concerning. Um, One thing that I'm not going to talk about here, but we'll talk about a little bit later, is that this syndrome can actually be very well treated with vaginal estrogen, um, which is very helpful. All right. So, another common complaint that women will have is I'm gaining weight and now I've got this belly, which commonly is referred to as the meno belly. And for years, we would tell women you're just not exercising enough, you're just eating the wrong things. Just work harder and do better. Now we have really good data that shows that women do gain weight during the perimenopause years. It doesn't, the weight gain is sort of steady through those years. It doesn't increase significantly in the years before and after the final menstrual period, but it does increase. But look at fat mass and lean mass. The women gain fat mass during the perimenopause years, and you can see like 8 years before the final menstrual period, they're gaining fat mass, and then it all of a sudden takes a steep incline. So there's a steep rise in the rate of increase in fat mass. And then a few years after the final menstrual period, it levels off. And the same thing with lean mass. Women start losing lean mass, and then that rate of loss increases significantly in the few years before and after the final menstrual period, and then it levels off. So women are losing muscle, they are gaining fat, and that fat is generally in their abdomen. Their weight doesn't change significantly in those few years, but their body composition does. Cardiometabolic changes happen during this time as well. The decreased estrogen leads to an increase in visceral fat specifically. And then it also leads to decreased muscle mass and increased fat mass, which is what we just saw. And when you reduce muscle mass and increase fat mass, that actually decreases your resting energy expenditure, which means that you burn less calories just surviving, just being alive, which leads to weight gain. That, in combination with the usual changes of aging, which is decreased physical activity and decreased energy expenditure, also leads to weight gain. So you have all these factors that are from different sources leading to weight gain in menopausal women. And so this is what happens during these years. It's the standard change, which is not just a issue because of cosmetic reasons, it's an issue because of health reasons. When we increase our visceral obesity, then we are at increased cardiometabolic disease risk. So women develop insulin resistance, increased cholesterol, hypertension, metabolic syndrome, and fatty liver disease. This actually also increases women's cancer risk, and then women obviously have mechanical complications if they're gaining weight, such as osteoarthritis, obstructive sleep apnea, and reflux disease. Cholesterol changes happen normally as we age. Our cholesterol levels generally tend to rise, but there's also a dramatic increase in the perimenopausal years, just like there is with an increase in fat mass. And this study showed that as well. In the years before and after the final menstrual period, LDL increases at a steep rate and then levels off. And then apolipoprotein B, another atherogenic cholesterol particle, increases at a steep rate and then levels off. So I've presented a lot of information that is a little bit overwhelming about the symptoms that women go through during this time, and then the health issues and the increase in cardiovascular risk that we suffer through as well. But I want to leave you with the idea that all is not lost. We do have menopause hormone therapy available. We'll hear a lot more about that. But I wanted to show this one study. It's a meta-analysis of 107 trials evaluating the effects of menopause hormone therapy on metabolic outcomes. And what this study showed is that with menopause hormone therapy, women actually had a reduction in their abdominal fat of almost 7%. They had a reduction in their insulin resistance markers, a reduction in the LDL to HDL ratio, lipoprotein A, little a went down, and then blood pressure also went down. So by restoring hormones that women naturally have in the premenopausal years, a lot of these negative consequences of perimenopause can be changed and prevented. And with that, we are going to go to our next